often hear about the effect the sun can have on our skin, right? Some of us feel really guilty when we hear this over and over and over again. Other lifestyle choices, though, like alcohol and smoking, can take a serious toll on the way we look as well. And we can all see just how much damage we've already done and perhaps what might be ahead, thanks to Dr. Daniel Shapiro and Christy Harris, an esthetician, and our lovely model, Stella, with the aging mirror. So Stella, you posed, show kind of how this works.
It's really easy.
You posed for a picture, you snapped away, right? And we have the result here.
Right, we get a readout on the computer.
Within moments.
Within moments. Okay, let's bring it over here, Stella, because we've got the results. And what are you seeing? How much damage has our young model done?
Well, let's talk about what's important about this.
Okay.
Basically, you don't want to have to see me, okay, in terms of having a facelift. I do a lot of facelifts, and what I see in the operating room is a lot of sun damage, a lot of elasticity that's gone. I think a lot of the collagen has been depleted by some lifestyle choices.
Right.
And interestingly, I see younger people needing surgery or wanting surgery in their 40s, 50s here, as opposed to back east, where it's more like 50, 60, 70.
Interesting.
Yeah, so I think that you can be proactive in terms of choices that you make, either lifestyle or how you treat your skin, and this is kind of making you realize that and give me a report card.
This is sun damage that we're seeing here?
Right now we're seeing sun damage.
Okay.
And this machine will also give you an estimation of dilated blood vessels that is can be due to drinking or smoking or sun damage.
What are we seeing here?
That is the blood vessels right
and
there.
This
That's
reveals
the
alcohol,
well,
which shows that Miss Stella's been pretty good. She's not been drinking.
She's been very good. And in fact, the readout says that she's about the 75th percentile. So her report card is, you know, probably an A here.
Okay, what about smoking?
Smoking, well, smoking will cause a lot of things. Mostly it causes decreased oxygenation, so it causes problems with elasticity, wrinkles, it makes your skin look dry, and as a plastic surgeon or as a doctor, it's about the worst thing you can do for your skin.
So I don't smoke, so what does it say about me? Can you tell?
Well, you can tell. I mean, your skin is actually in great shape. People that come into my office and they get this done, a lot of times that they've had, you know, drinking and sun exposure and smoking, I mean, it looks like an airstrike.
This isn't for self-torture, and this is actually a free service there at your offices. But and let's bring Christy in on this. This is really to help come up with a treatment plan. And one of the things they were saying about you, Stella, is that it shows that you use the Clarisonic. It shows that this thing works.
Well, really, and I actually had one with me here at the station because that's what I use to take off my makeup.
Okay.
Yeah, so what we're looking at here is porphins on the skin, which is like superficial bacteria. And I can tell the difference if I take a client back, cleanse them with just my hands, take their picture with the Visia, go back, cleanse them with the Clarisonic, take another picture, I will see these porphins decrease greatly just by using the Clarisonic.
How often should people be using this?
I like for you to use it once a day. If you can be disciplined to do that, you know, it's a great way to kind of give yourself a little treatment at home and maintain your skin. Great for men too.
And we've seen changes in people's habits with the Visia. So
well, yeah, you've got a guilt report card. It's right here.
Importantly, you should hydrate. You should moderate your drinking. And if you smoke, you should try to, you know, not smoke. And also sun exposure, sunscreen. You should really, in a perfect world, see somebody like an esthetician to have turnover of your skin cells. And the beautiful thing about the Visia is it will give you a treatment plan, and whether it be some procedures that we do or a product line that is optimized exactly for your readout, so exactly for your situation, and also it will give you a means of seeing your progress.
Yeah, see where you will be down the road.
Exactly.
Question for you, that's my last question.
Sure.
It won't scream at you if you've been doing terrible things.
Not at all.
You don't feel guilty. It looks worse than it is, doesn't it?
Yeah,
because you see all those spots.
Thank you so much. We're going to put all this information up on our hotline for you. April, does this make your heart race just a little bit?
A little bit.
Just a little bit.
A little bit.
It's worth it, though. I mean, the fact that you can actually take a look at what's going on in the future eventually to get you on a treatment plan, you know, I call it that restoration project.
You know, if it's